Good evening, my name is Juan Donis, and this is my final project. Public and community health are the means to the health and well-being of a population. Public and community health are able to detect, treat, and prevent disease through a organized and structured and funding that is supported by our nation's government. However, the policies developed and implemented by public health agencies must follow a code of ethics that are based on strong and clear communication. Charles Edward Amory Wilson, known as the founder of Yale's Public Health Department, described public health as a science and art of preventing disease, prolonging life, and promoting health through early diagnosis and prevention, which public health aims to ensure everyone a standard of living Public health in today's world still works off the idea Wenzel established. Public health agencies are focused on ensuring everyone's well-being by addressing the health needs of those most in need. The idea of a healthy and well population is nearly impossible without a public health agency to effectively promote early intervention and prevention of disease. The three functions that allow public health to be effective are assessment, policy development, and assurance. Assessment of the public's health is done by analyzing health statistics, health disparities, as well as epidemiological studies. Policies are then implemented to address any and all deficiencies that came to light during the assessment. These policies are established and based off scientific evidence to achieve a higher state of wellness. Assurance is given to the community through policy regulation. This assurance process is to provide evidence that the policies implemented are the appropriate vehicles necessary to reach a higher state of wellness. Community health operates off the same key principles seen in public health. The major differences are that community health focuses on a specific population and the health disparities found in that population. For example, addressing the high rates of diabetes seen in Hispanic American populations would be considered an initiative of community health. Why worry about a healthy population? The effect chronic illness has on the economic status of the individual and of the community is reason enough to strive for a healthy society. On the individual level, chronic illness often leads to early death and can inhibit your ability to work, which results in decreased income for you and your family. Here in the U.S., income levels are not in sync with the skyrocketing costs of living. This gap is resulting in higher rates of poverty. Poverty leads to an individual's inability to pay for insurance and increases their food insecurity. The lack of insurance limits a person's access to adequate care, while food insecurity increases the risk of preventable diseases such as obesity and diabetes. Public health here in the U.S. is organized through federal, state, and local agencies. On the federal level, public health agencies are primarily focused on the ability of every level to provide adequate and necessary public health services. Federal agencies are able to do so by regulating policies and providing funding for research and training. State public health agencies are designed to focus on the health disparities of that specific state. This is done through detection, treatment, and the prevention of diseases and illnesses. Local public health agencies are designed to observe health disparities, promote health policies and programs, and direct individuals of a specific community to the appropriate health services. The Code of Ethics established by the Public Health Leadership Society states that public health agencies should do the following: address the fundamental causes of disease and the requirements for health and disease prevention, achieve community health in a way that respects the rights of the people in the community, develop policies and programs that are assessed through evidence-based procedures while still allowing the input from the community, act as an advocate for the disadvantaged populations, and strive to ensure the basic needs for health are available to all. Gather data that is relevant to health promotion and the mission of the public health agency. Have policies developed for public and available to the public in full disclosure, and require the consent of the community prior to being implemented. Take appropriate action in a timely manner. Develop policies and programs that are designed to meet religious, economical, social beliefs of everyone in the community. Develop and implement policies and programs that promote the community's physical and social environment. Keep gathered data protected and confidential. And lastly, ensure all agents of the public health agency are professionally competent. In the U.S., the Affordable Care Act, through the Prevention and Public Health Fund, has allotted $927 million to preventive health research, surveillance and tracking, public health infrastructure, immunizations and screening, tobacco prevention, and public health workforce and training. The majority of the funds were given to the CDC to continue work on heart disease, tobacco control, diabetes prevention of healthcare-associated infections, and other critical public health issues. It is estimated that for every 10% of increased funding, community-based public health programs can reduce deaths due to preventable causes by 1 to 7%, and that a $2.9 billion investment in community-based disease prevention programs can save a community $16.5 billion annually. Strong and well-established communication is pivotal in the success of the public health system. The public health system here in the U.S. is a multidisciplinary web of professionals and organizations. For the best possible result, clear and accurate data must be gathered and analyzed. To do so, professionals like epidemiologists, medical doctors, and even EPA agents must work together to accurately assess a population and their health needs. The need for strong communication is seen during the policy and program development and implementation phase. One of the best ways illness can be prevented is through education. For example, reducing rates of diabetes calls for a change in lifestyle. This change in lifestyle is accomplished through clear and smartly presented information. At the same time, the policies implemented should represent the target audience and meet their culture needs. If the communication pathway is not established, then tasks cannot be accomplished.